From Venture Z Studios.
Oh yeah.
And y'all, I am coughing and sneezing a lot today, but it's all allergies.
COVID.
No, don't say that. And you can. My voice is all sinusy.
Okay, this will be code word Rovid. Someone's got Rovid.
But anyway, so, God, like 3 weeks ago, before the election, you know, our tagline in Collin County was "Liberty is on the line."
Right.
So our tech guy, IT guy, had made one of those frames, and it said "Liberty is on the line, vote Republican." Little
Bingham?
cute red, right? Yeah, Chris Bingham, great guy, great, cool little thing. And I was like, "Oh, I'll put that." You know, so a few days before the election.
We're live.
Oh, hello. Well, so, I mean, like, I changed my profile picture forever ago, and he put, and so then he just commented in my comments last night, "Nope." And I was like, you know, I asked you not to be tacky on my feed.
Yeah, I mean, if you can't handle it,
And I'm like,
on.
dude, you know.
You can't handle the truth.
You can't
Well, I'm
handle
like,
the
you know what?
truth.
You know, if anybody sees, I mean, stuff on my page, it's either the kids, my puppy, positive. It's mainly the show.
Kathy, we got to share.
Oh, we're on.
We're on, Kathy.
Oh, hello.
We got to share, Kathy.
Share for y'all.
This is our share moment, Kathy.
Lord have mercy.
Lord does have mercy, Kathy.
Yeah, thank
Monday
goodness.
morning.
Thank goodness.
It's Murphy's Law Monday today.
Week and a half till Thanksgiving.
Why
Is
are you?
Dr.
Why are you making weird voice? Like you haven't talked in your normal voice once this morning.
Hey,
Hello.
is Dr. Novid on the phone?
Has Charles had a shot of something besides caffeine?
Yes.
Actually, I haven't had hardly any.
John's
Okay, we're ready for the live.
I had to put a little
from
sippy cup lid on my coffee.
a little
Saturday, I had a
sippy
couple
cup.
accidents.
That's the truth.
Yes.
Yeah,
was like
that's the
2
truth.
coffee cups.
He spilled coffee twice. I was like,
Yeah, not
what
once.
is up? It
Yeah,
was
and my cup was evident. It wasn't like I hid it.
No, I moved it to the table,
Yeah,
but then a box falls over and knocks it over. And I'm like, oh my gosh.
From VentureX Studios, it's JP, Kathy, and the crew.
The crew, the crew.
The
Well,
beautiful crew.
We have isolated ourselves here at VentureX Studios. We've closed the door. We are the only 4 people left in Dallas-Fort Worth that have not gotten COVID-19. And we're going to be talking about that. I'm just kidding. But it feels like that. If you watch the news, you're going to feel as if everybody around you has COVID-19 and it's coming for you.
Well, have you noticed, like, and you and I are allergy ridden.
God, my allergies have been
We are. They've been
horrific.
horrible. Like, I honestly, I think I'm going to go get tested and get back on allergy shots. So anyway, I've been sneezing, coughing. I mean, you can't even tell my voice is all sinusy. Just allergies. My eyes are weeping. But boy, if you are out in public and you sneeze, even with your mask on, or you cough or clear your throat, people will turn around and give you just the evil eye.
Well, here's...
And I'm like, it's allergies. You
Well,
know?
here's the
Have you had
beat
people
down.
do that?
Oh, yeah. And
Well,
I look at them and I do this. You ready for this? You're going to love this. I had a lady give me a really snarky look, and I went like that.
Of course you did.
You betcha I did. I was like, and I just threw my hands, and I was like, too bad stuff didn't come off my hands. You know, so as you can gather, Dr. Clothier is going to be talking about COVID-19, the travel season, what to look for, how to avoid potential illness. You know, one of the things I'm going to ask him as well is what is the fastest, easiest way to determine it's not COVID-19, and it may be the flu, it may be strep throat. We have a friend, a common friend, that's hit this last weekend. She had 2 COVID-19 tests come back
Right.
negative.
Is it the girlfriend that you and I were talking about earlier?
Yes,
Mutual
ma'am.
friend? Okay,
Yes,
yeah.
ma'am. And
Yeah.
so hopefully we've got Dr. Clothier coming on here. Because we really have a lot to talk about with Dr. Clothier. I have now shared out to everybody.
Share, and
Did you?
share
Hopefully
again.
he'll be here soon.
So
Wow, somebody's
get
got
Dr.
audio on.
That would be me.
JP's
Not
very
anymore.
sleepy.
I'm sleepy. So a lot going on with COVID-19. Here's one of the things I do like about all this craziness and madness. You can go on the cdc.gov's website, and under their FAQs, you can look up by county the death rate. And it shows a map. And of course, I can't, as you can see, I have a iPad in front of me today. Didn't get to sleep until really, really late this morning, doing a
or
lot.
really, really early this
Well,
morning.
yeah, or really,
technically.
really early this morning. And so I left all my technology at home. I left my hat at home. I'm surprised I'm here. I think I left my right pinky at
And
home.
I love it because you're all dressed up. I like your overcoat. That's a really nice jacket. Is that new?
No, I've had this for years.
I like it.
Thank you.
But I believe JP has flip flops on under the table.
I do have flip flops on.
Yeah,
yes.
I just-
They're fancy though.
It's hilarious. You and my brother and y'all's flip flops.
Yeah,
Never
sorry.
seen. There's ice and snow outside, and y'all are shaking it off your flip flops.
When you
am-
walked in, I thought you looked like
Forgot.
the Untouchables. With
Yeah,
your
he did.
Overcoat.
That was cool looking. Thanks, Chuck. But yeah, I'm wearing
times.
flip flops. I'm wearing suit. I did tell Kathy though, I am wearing suit pants, button down shirt, and my bow tie though.
Yes.
And it is No Shave November, by the way. So if you're wondering about,
Oh, you're Movembering it up.
well, and here's my
Movembering
theory.
it up?
Here's my
Isn't that the
theory
mustache
on
thing?
that. You ready for this? Here's
What?
my. Oh, is it?
Movember.
Oh, Movember. I thought
Right.
it was No Shave November.
Oh, well.
Is it No Shave
Isn't it
Movember?
Movember for
Is it-
mustache
is it- I
November?
don't- no, it's not mustache. Beard. Is there a beard?
I mean, like guys
beard?
don't
Like-
shave during November because
Right.
of what kind of cancer?
Yes.
Prostate. I was about to say
testicular.
Is it
testicular, but it's
or
prostate.
testate?
Prostate, I think.
It all
is it
anything
prostate?
down in
Awareness.
that area. We don't want cancer.
Yeah,
Anything down in
yeah.
that area.
Oh. Anything
That's
down
very
in that
medical
area.
Monday-ish.
It is. Do we have Dr. Clothier yet?
He is in the midst of joining.
Oh, okay, very
Alexa
good.
and Lente.
Very good. Lots and lots to talk about with him. If you look, what I'm curious about, and Charles, what I'd like you to do, because again, I'm not on my computer, I can't necessarily send you the link.
Right.
But if you just go to Google and you search, what did I put in the search bar, Charles? COVID-19. I just put
So,
COVID-19.
Dr. Google?
Pretty
You're saying
much.
Dr. Google?
Yeah, pretty much. But go to the CDC's FAQ
Uh-oh,
and
I hear somebody, too.
go to view, not view, I don't guess it's a view, but it's the death rate. You can pull that up under the FAQs that come up. And the reason why I said this is because a map comes up, and I want to show this map.
The Texas one?
No, it's of the United States. And what I don't understand is I'm looking at that map, and there are tons
Good morning to the crew.
of
They're very active this
counties.
morning.
Are they?
I love it.
Yeah, and I can't get on there and talk to them because I don't have my computer. But it's very interesting how there are so many counties that have had a very small affliction by COVID-19, and they have a population of 100,000
Who is this?
all over the country.
You want
Oh.
you said U.S. data or county data?
No, it's the county data, but and then you have to pick the state, but it'll show a map where COVID-19 has struck and where it's the heaviest and versus the least. And it's
What you want me to pick Texas?
no, I want to see the whole U.S.
Oh,
map.
gotcha.
And do we have Dr. Clothier in?
Yes, we do.
Yay! Good morning,
Yes, it's
Dr.
yesterday's
Clothier.
cases and deaths
Good
by
morning.
county.
He's the expert.
I'm-
Let's see. We like.
Good morning, Dr.
Trying to
Clothier.
get my voice and my picture going. Let's see.
Oh, okay.
I don't know if it'd be trouble if we had neither, wouldn't it?
Well, yes,
Yes,
that would be problematic.
Because
Yeah,
you're the
because
expert.
there go the lip readers in case my voice is out.
Well,
so.
it'd be hard to have hieroglyphics sent over and read
Yes.
hieroglyphics. Yeah.
Let's see here. I am trying. I can't seem to get a picture on there, but anyway, I'm here.
Well, so
There I am.
Dr.
Okay,
Clothier.
wait, no.
Oh, there you go.
Yeah.
There he is. Oh, you look
yeah,
nice
good
in
morning.
blue.
Good morning.
I don't see you in blue very often. It looks good on you.
Well, thank you.
You're welcome.
Blue Monday.
Blue
Yeah.
Monday.
Yeah.
Murphy's Law Monday for sure. So, Dr. Clothier, I brought us in
Yes.
with today. Dr. Clothier is going to talk about COVID-19. We're going to talk about traveling, how to protect yourself, stay safe while you're traveling during this holiday season. What are the pitfalls? What to look for? And while we were waiting for you to come on, I typed in just COVID-19, and it brought up a map of yesterday's cases and deaths by county. And so this map, I don't know if you can see the map. Are you able to see the map, Dr. Clothier?
Well, let me get my telescope out. And,
Okay.
Is
He's
that-
looking at it.
Is
from
that the
here.
election map?
Maybe.
Oh, I see.
Is
He's
it the
looking at it from
election or the
computer.
Yeah, there
COVID?
we go. That's a little better.
Well,
Yeah.
here's my
Boy,
big
how
question.
deep is that studio? Yeah, go ahead, though.
It's pretty deep. So the light pieces are going to be the fewest cases, and then of course the dark intensified are going to be the most cases.
Sure.
And a lot of these counties are doing it per 100,000, and yet their losses are under 0.1%. How is it that all these other counties are able to do this? Is there a temperature involved? Is there a climate involved?
Let me just ask, what's the date of this map?
This should be, it was 4 p.m. Eastern time as of yesterday.
Okay. I'm curious because I see on there South Dakota looks pretty white to me from here. I could be wrong. But the South Dakota has one of the highest rates of increase. In fact, the highest rate of increase of anywhere in the U.S. right now at over 500% more than the rest of the country.
Well, and this is going to be by
so
county.
I'm not sure about the accuracy of the numbers unless it's just many of those counties don't reach 100,000 people.
And it could be part of that. That maybe that's part of the answer. Maybe they just don't reach.
It's also fading even as we speak. So I think coronavirus is ending. Wow.
Okay.
No, that's interesting. I'm glad to be able to be here to see that.
Me too.
No, I wish
Breaking news. No.
Yeah, we may actually have an immunization on the horizon, it sounds like.
Yes.
Which shocks me. I think I was not expecting anything to be put together this soon or to be able to be distributed. But if we could do that, that would be pretty incredible. But to answer your question, about the rates, the death rate in most every significant number of population statistics, in other words, if you have enough people to really measure a death rate, because it's not just sporadic cases, has been between about 0.1 and 0.4%. Texas, the death rate is 0.4% for the state, 0.36% for Dallas County right now. And so, the death rate is not really as high as you think. The challenge I find, and obviously I don't mean to sound insensitive about this, because many people are going to die from it, and many of those are expected deaths from it, I would say, just from age and infirmity. The challenge is the rare cases that seem to just devastate a person who's younger and healthy, or maybe even more meaningful over time, just statistically speaking, is the number of cases that have lingering symptoms. We've talked about myocarditis, and there's kidney failure, and there are neurologic changes. There's profound fatigue, brain fog, which is always one of those hard ones to define. But, people are not as sharp as they previously were prior to COVID infections at times. And then other times, people have 2 or 3 days of symptoms and they're fine. And of course, we've talked about the asymptomatic carrier,
right,
who maybe wouldn't even know they're positive unless they did a test because they had a family member who's sick, and they seem to be fine. So it's the unpredictability that I think is one of the most challenging things. And I think I compared it to polio a few weeks ago. The challenge with polio when it first came around was that, believe it or not, 25% of people who became infected with the polio virus died. And that is a shocking number when we think about 0.4, 0.36% right now with COVID. But then, after the first wave of death, there was the realization that there was frequently a permanent neurologic deficit, a weak leg, right, or true paralysis on both sides, or, an uncoordinated arm or something like that. That was the long-term outcome of the polio virus that wasn't seen early in the phase of the treatment, of the infection. I think all of us have been trying to compare COVID to influenza, and the challenge is they're different viruses,
Right.
But when we look at influenza, there basically are 2 outcomes. You either get it and you die, or you get it and you recover. There doesn't seem to be, any lingering chronic chronic influenza syndrome. There may well be a chronic coronavirus syndrome that we just don't
know yet.
No.
Yeah.
Right.
Well, and I've had a couple of friends who they had it, like even one of my girlfriends who had it way back in March. I mean, she was one of the first, she was the first person I actually knew as a real person who had it.
Zero for you.
Yeah. Yeah, but she still has never gotten, and she's younger, has still not completely gotten her energy back up to where it was before. She said now going through life, it's like she always needs a cup of coffee all day. And she was never like that before. So
yeah, I'm hearing a lot of that from people. And, one of them, for instance, a patient of mine who's in his low 30s, very, very healthy prior. He had no underlying even allergies, allergy, asthma, none of that. Got COVID. And I tell you, he said he wheezes. He, gets short of breath going up the stairs to his apartment. And, those are the hard ones to really figure out what's going on. And that was back to June. So we're talking about 5 months. So I just want to point out today, because I believe Thanksgiving's still rolling around next week, since it's always the fourth Thursday in November. But today is November 16th.
Right.
Next week will be November 27th. That'll mark 1 year since the genotype was discovered of the coronavirus of COVID-19.
Okay.
Remember, it's COVID because it's coronavirus disease of 2019. That's why it's called COVID-19.
Okay.
It's not 19.
That's funny. I didn't know that until you just said that. I didn't realize where the number was from. It's from the year.
Yes.
Oh.
And so that's why nobody talks about a COVID-17 infection, for instance, because there really wasn't any. So it's based on the year of discovery. And excuse me, my voice is still kind of not mine this morning, but so it'll be a year next week. And so we still, to this day, don't have a year's worth of data on anybody with an infection. And I think that's just, something we still have to keep in mind in terms of when we talk about long-term outcomes, long-term studies, none of them have approached a year yet. The first documented case in America was January 20th, although I think, I know a number of people that are fairly convinced they had it before.
I've got people who said they're like, I had it.
A lot of people believe they had it. And I think they did have a bad cold. And, I mean, honestly, looking at the antibody numbers, I just don't see that many, that would encompass thousands and thousands of people who had it before the first documented case. And of course, part of that was nobody had tests for something we had never, ever heard of. So, there are challenges, but looking at the antibodies, it's just, the proof isn't there.
Well, and we've got a question for you from a member of the crew out in Arizona. She says, a question for the doctor: will he be getting the vaccine as soon as it is available?
That is a great question. The answer is I don't know, because there are so many factors in that. I am getting that question a lot from patients. And I think it's an excellent, excellent question. So let's cover that for a moment, because that is a multi-layered question. One is, would I take anything that has not yet been revealed? And the answer is no. I don't know what's going to be in this virus, what antibody it's going to try to stimulate from what antigen of the virus. I don't know if it'll be stable or unstable or a repeat needed, or if it'll be a 2-stage shot or a 1-stage or a 4-stage, 3-stage, whatever.
Right.
So today, I can't answer that as yes, because I have zero information other than I've heard a media report that Pfizer is developing an immunization. There's no science released yet. And that the reason is obvious. It's proprietary. It's their work, and they haven't released the information. So the first thing I'll do once that's released is I'll read through every bit of research I can get my hands on, my eyes on, and read through that research. And then if it appears to me that it's a logical, stable, not likely to be devastating, in terms of versus the virus, then I would, yes. But only after that careful research. Now, the other part of that answer is I am in the healthcare field, as we know.
You're exposed every day, possibly.
Yeah, it's very likely that I will be told I'm getting it by insurance companies, hospital systems. Because at this point, which is, I want to emphasize, fine with me, that I'm required to have a flu shot, for instance. If I'm going to step foot in a healthcare facility, I must have a flu shot.
Right.
That's true of nurses, respiratory therapists, doctors. It's true of vendors who go in and work on, like say a surgical robot.
Yep.
They have to have a flu shot. So in the healthcare field, the answer is also a little different.
Right.
Because it may be something that if I want to go ahead and stay employed, then, well,
you might not have a choice. Exactly.
Right. But I'm still going to read all the research and know what I'm getting.
Absolutely, yeah.
So to me, it's almost like saying, we keep hearing about, say, for instance, the Ford Bronco coming out. I wouldn't go buy one today because it's not going to be out for 3 more years or something,
Right.
or that the electric Hummer they're advertising. They look sharp, they sound sharp. I haven't seen one because there's not one on the market. And I think that's the fair answer to the immunization question. Now, we do need to address what's going on with Thanksgiving coming up in 10 days, because that's a big deal for people too. And I'll tell you, as I mentioned last week, you should have started planning, I hope, for Thanksgiving last week by being relatively isolated, socially separated from as many people as you can be, to reduce the odds of being a carrier of the virus to a family gathering. The current CDC guidelines, and again, I'm just going to emphasize, don't kill the messenger. If you have any complaints, in fact, I'd say address them to JP and Kathy, not to me.
And the crew.
No, just kidding. I don't want you to get all the complaints about me. But the CDC guidelines right now are limit your activities to 3 family units or fewer. And again, as we emphasized last week, that's extremely variable. My family unit is 18 people. There are some who are 1 person, 2 people, 3 people. So I'm thinking that what they mean is about 20 people. They won't, they haven't given a number of that. But then the newest guideline that came up since last week is when you're there, it already mentioned socially distancing 6 feet or more, wear your mask whenever you can. But they added that when you take off your mask to eat, do not say a word. And,
oh my gosh, that's so hard. That's when my family talks the most.
I can't quit talking long enough to chew. I mean, that's
yeah.
And so I think that's going to, especially if you're gathered with relatives that you haven't seen since the beginning of the plague.
Well, yeah.
Pandemic, excuse me. We're talking about months worth of catching up. It is also natural to have a discussion as a family. I've been in some. And so I think it's going to
one or two.
Yes. I think it's going to be extremely difficult for people. Now, of course, keep in mind, this is CDC guidelines. Who's going to be criticized if there are large outbreaks if people weren't warned? The CDC, right?
Right. Oh, yeah.
So, they've warned everybody. I know I've got a lot of friends and family who are like, you know what? And somebody posted who had just recently lost someone close to them in their life. They posted on social media that, please live your life, enjoy, Thanksgiving, enjoy Christmas with your family as you normally would, because you don't know if it's going to be your last. Not because of COVID, but just you just never know.
You could have a bad car wreck. You could develop
so would you want to not see your family and not enjoy them? So again, it's that end. Unless you're in California, then you don't have a choice. You've got all kinds of rules. Goodness gracious! But
that's why everybody needs to move out of California.
Except
they are,
Except for the governor.
Yeah, keep Newsom there though.
all the Americans who love freedom. I want to make sure I emphasize that.
Yes, who love freedom. Yes.
But anyway, here's what I would suggest we need to do about this, because you're right. People are saying you've got to get together with family, and I agree. You can't replace family time.
Right.
Here's where you prepare. Okay, you still need to socially isolate prior to going. If you're in a high risk field, you should get a test before you meet together with family, if you possibly can. And the problem, again, with testing, of course, is sometimes that there's a delay between getting the test and the results. So don't get a test and then go out in public and maybe gather up a virus.
Right.
And take it to your aging grandparents or whoever you're going to go see. The next step is communicate about, you do need to try to stay as socially distanced as you can. You should be in a mask when you're not eating, I believe, if you're indoors, or you should meet outside. You should have an outdoor meal, and that reduces the risk significantly. But you also, I think, need to have some discussion beforehand that you do realize you could have a family outbreak of the virus. And what are you going to do if you do have, let's say you have a family gathering of 15 and 10 of them get the virus? I think you have to communicate that beforehand and make sure people are comfortable being there. And if somebody says, I don't think my chances of getting the virus are very high, but I'm not willing to risk it, then you shouldn't ostracize that family member. You should maybe offer to get them food delivered to them or
Oh,
meet
yeah.
them by Zoom.
And I thought that was great
You
advice
know.
that you gave a couple of weeks ago when you talked about, hey, have the discussion ahead of time so there's no
Yes.
shock and then you don't feel like somebody's, just saying, oh, no, I'm just not going to come. Somebody says, hey, I'm nervous because I'm going back into my office in 2 weeks, or I'm concerned because I've got, high blood pressure. I'm concerned because of whatever reason. So I thought that was great advice that you gave, because we send a big family. We've got a big group email that we send around because we've got a large number of folks that we all get together at Thanksgiving. And a couple of people aren't coming, so everybody kind of chimed in and said ahead of time if they were coming or if they were not. And then you have those conversations. Hey, don't be offended if you come to give me a hug and a kiss like we normally do. If I
Sure.
just say, oh, air hug or blow kisses kind of a thing.
Yeah, it's time to forgive, not to hold to some odd standard that you yourself have. And, I want to mention, too, I'm hearing more and more people make comments for understandable reasons about their loved ones who are, say, in a facility, whether
Right.
a nursing home, assisted living, memory care,
Right.
et cetera, about them saying, well, I think at age 87, Aunt Helen would rather me come see her, and maybe she'll get infected and die, and she'd be happier about that, but knowing the end of her life is coming up soon anyway. And so we shouldn't restrict the number of visits. And I do agree that the biggest complaint we get ever about facilities is people don't come visit. And this has been a terrible year for that. No doubt.
And that's why depression and that isolated feeling has been horrible. Again, we
is.
have to
And,
balance the
undoubtedly-
mental health with the physical health.
Right. It seems to cause even more decline for memory, for instance. But the problem is, what you have to keep in mind is that there also are other people. And if you say, I'm going to go visit my elderly aunt who's fine with this, you're disregarding the person who maybe is later cleaning her room and has a grandmother she lives with at home that she could carry a virus to
Yeah.
and cause the domino effect, or the neighbors. We all know none of those facilities have a whole lot of space between rooms and the hall and such. And I don't know what kind of ventilation system they have, if they gain air in and out of there. I think I think you have to realize that there are other people involved too, all the way from the employees to other families visiting, whatever. And you just have to think those things through. And it may well be that the best option is to somehow visit by, distant means, or even, I know a lot of places are doing what they can with windows.
Yes, I was just
and
thinking
that's
about that.
super frustrating. I know it's frustrating, and it's going to become more of an issue as we get to Thanksgiving and Christmas.
Yes.
But the problem is, you still have the domino effect. It's almost that it probably a poor analogy, but if you're rushing somebody to the hospital, and who is in need, needs to get to an ER, but you disregard every light and every car and every traffic signal, whatever, along the way, and just start smashing into people, that's not the right thing to do either.
Right.
And you have to figure out a way to be able to see that person by some sort of visit, maybe even old-fashioned phone calls or whatever, and realize it's just a terribly difficult time for all of us. So I think going into the holidays, we just have to realize, and I'm concerned about the fact that many college kids are coming home this week
Yes.
because of Thanksgiving break, this weekend, and many of those are staying home after Thanksgiving because schools have determined, they don't want people to go home, pick up the virus, bring it back to the campus.
Right.
So, like, I have a son who's going to finish out the last 2 weeks of the semester virtually and then have finals
Oh,
the
interesting.
third week after that. That's
Interesting.
become kind of a big thing for colleges.
Okay.
So,
Makes
even
sense.
as you have people come in from outside communities, whether visitor or family, you have to be realistic about paying attention to symptoms, because we still don't know who's going to get the devastating infection and who isn't, and who's going to get the lingering infection and who isn't.
All right.
And obviously, no matter how much talk or even hype or even excitement there is about an immunization, it's not available yet. So going into Thanksgiving to Christmas and New Year's is another time people tend to get together in crowds. And of course, all those happen in cooler weather when we tend to see more infection anyway. do all you can to be realistic and careful and forgiving of people. And you know, if somebody seems to be sick 2 days before Thanksgiving, they may have to pull out, and that may save a family. And I think it's really important to realize that, you know, when you're talking about 0.36, 0.4% death rate, that still involves people. And I think, you know, you still would want to minimize that all that you realistically can.
Dr. Clothier, hundreds of thousands of questions, you know, surfacing regarding all of this in all kinds of directions. And I'm going to throw this at you as kind of a shotgun approach and let you just go bam, 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 and knock it all down. In Europe is seeing the same, if not higher rate of infection, but yet they're not closing down schools. They're trying to keep schools open, keep universities open. Their argument is that schools are able to maintain a healthier environment, and that the coronavirus is exchanging more at evening events where people are getting together and gathering versus schools, universities, or workplaces. And so that's one that I'm throwing at you.
Sure.
You know, is that a good factoid or not? Number two, when you get on a plane, is it good to hype up on vitamin C and other type of vitamins that may help your immune system fight off the amount of coronavirus you may be intaking or not intaking? Because, you know, you and I have talked about this, and you've said, you know, we're all probably breathing in some portion of it. It's just not enough for our bodies to react to it. So that's factoid number two. Factoid number three, again, the shotgun approach.
How many barrels are in the shotgun?
Just three. There's just three.
Okay, all right. Go ahead.
But you've got this, though.
You almost made me spit coffee out my nose.
Which I would have paid for you to do.
Biodegradable.
It is biodegradable. Number three, Black Friday sales where the facilities will be open. Let's say a Best Buy. Let's say a Target. And so in the store, they only allow so many people, but yet you end up finding yourself in a line where nobody is really socially distancing, or they're not keeping or maintaining their masks while they stand outside. Besides not going, are there measures you can take to protect yourself from any and all of these scenarios with what and how?
Okay, very good. I'll try to address each of those, and then I must go and do my day job. So first, you know, any university or school says well protected by a closed environment as the behavior of each individual. And I think it's, you know, if a school has a relatively rigid control of who comes and goes, and I believe that to be much more true in Europe than it is here, I think that does seem to maintain a relatively lower risk of virus in people who are relatively younger and who behave very properly. It is true that there's more spread in family gatherings right now, for instance, than in other more public scenarios, but there are two reasons for that. One is those more public scenarios are often not happening. There aren't concerts, there aren't sporting events with full stadiums, for instance. And the other is that people are being screened before they go in. Whereas a family gathering, I don't know many people who are stopping people at the door, questioning them about symptoms, turning them away if they've had symptoms, and checking their temperature, and also social distancing and masking inside their home. So if you're in an institution like a school that requires all those things, I do think there's relatively lower risk than at home. The problem is in most of our society here, I think it's very hard to keep people under that much control. We are uncomfortable with that much control for very obvious reasons of other freedom and you know, free will. And so if you had only college students ages, you know, 18 to 25-ish on a campus who are really well behaved and keeping everything as careful as they can, they'll probably end up pretty okay because that risk in that group is not very high. You still have, though, in most colleges, professors who are, for instance, a little older than those students. The second on the flight and whatever is that the best immunity plan is to prepare by life, to have good nutrition, exercise, an excellent immune system before you plan to get on that plane in 10 minutes. Taking vitamin C, zinc, whatever is reasonable. I don't think it's going to prevent an infection if it's blowing in your face. And then on the third idea of the shopping, all you can do is what you do. If you see a crowd that's not social distancing, you can wait until the crowd's under better control.
Thank you,
And
Dr. Clothier.
those are just things we're going to have to live with.
Well, simple tidbits of information that just
Yes.
if good pieces of advice. And that's why I wanted to shotgun
As
it at you,
always.
because I knew you would get us nice and concise. And so thank you
I
for
think
that.
you've been wanting to shoot me for a long time.
Not at all. Not at all. I respect you greatly. So.
Yes, and we appreciate you so much. And at this Thanksgiving season, we are very thankful that you're such a big part of the crew and that you've been with us for so many years, giving such fantastic advice on a weekly basis.
Well, thank you. I appreciate it. I was young when I started.
You were.
We aged you rapidly.
Hey, happy
Coronavirus
Thanksgiving, by the way, to
problem
you and your family.
Well,
Yeah,
thank you.
I hope y'all
We're
have a
going to
blessed
enjoy our
Thanksgiving.
Thanksgiving. We're going to have it outside if at all possible. The forecast right now looks reasonable. We have sweaters, thankfully, in case it's a little cool. And I think we all can be pretty careful. And so
Yeah.
please do be careful. Please don't be one of the families that's hit hard.
Right.
Amen. God
Amen
bless you,
to
Dr.
that.
Clothier.
Thanks, Dr. Clothier.
Take
All
care. Goodbye.
You too.
You know, and again, I liked the shotgun approach with Dr. Clothier.
Of
Because
course,
again,
he's like, how many barrels?
Right.
He's so great.
but very concise, though.
yes.
Charles, if you'll go back and put that map back up, and here's the thing, you'll notice, and there are people that live in these white and pinkish spots, but and you can see the numbers as Charles rolls over the top. Again, what are these counties doing that the rest of us are not doing, right? Like in North Texas, Dallas County's numbers are soaring, but yet we can go throughout Texas and see.
Well, then I wonder, is it in direct correlation to population? So maybe
And it could be.
for example, y'all just flash Kaufman up there, and I know Kaufman County, most folks are out on a ranch or have some land, or you got to ride a horse to get to your neighbor's house, kind of a deal. So. And their main activity in a place like that is everybody goes to the square. Well, maybe people are limiting exposure that way. I don't know.
Well, and it may be, and this is where I'm going.
In North Texas, we're more on top of each other.
Well,
We're not like New York, but
Right.
still, there's a lot of us here.
Well, and that's where I'm going with this. Where I'm going with this is it's not that they still don't go out.
Right.
It's not that they don't go to the square. It's just that they're more mindful
Right.
of where they're at, who they're near. And that's, I guess, my whole point. My whole
Right.
point is that maybe if we were just a wee bit more careful. One of the things that I hear a lot when I'm out and about is a very cavalier attitude from some people. And it's funny, I'll go into a bathroom, use the restroom, wash my hands, but the guy before me just walks right out the door. And again, you're nasty. You just touched your business. Wash your hands.
And I'm going to go back, JP, because anytime you talk about this, I have to just say that when we first started this discussion, I was dumbfounded when you were telling me the amount of men who go into a bathroom and just go to the
Walk out
bathroom
the door.
and walk out the door. And I'm like, wait, what is happening? Like, I found out gross things that I didn't want to know. Like, I just, I assumed. I don't know. My mom didn't beat it into our head, but she ingrained that in my brother and I. Oh, wash your hands. We had to wash our hands before dinner, all that kind of stuff. So I did the same thing with my kids, like obsessively almost wash your hands, because, you're getting ready to put your hands very close to your mouth. And if your hands aren't clean, so I if anything, maybe COVID-19 has helped people learn to not be so gross or disgusting and actually wash your hands when you go to the bathroom.
Well, but here's the thing, though, right? Gross is still gross. They're still doing this. Summer Fox says on the feed, no one in my meetings wears a mask, and no one in the huge church that I go to wears a mask. And again, here's the thing, right? And I don't know if the masks are effective, not effective, if it slows some of it down, but not all of it down.
Right.
I will say this. Somebody made an interesting observation, and of course I'd already made the same observation. If you're at the grocery store and you're walking by, and I'll just be funny, the beans aisle, and somebody
you and
decides
Gail.
that they're going to give a little pooter out there, and that fart comes in through my mask, then am I really protecting myself from coronavirus? because fart particles are fart particles, and there you go. Now you're inhaling somebody else's poo on a very
Okay.
micro level. Here's my point. My point is that goes for anything. So are the masks really effective, or do they just reduce, right? I'm not saying don't wear a mask. I'm just saying, because I wear a mask, especially if I'm in a large group.
I just don't think anybody knows the answer to that. There are people who are like, it doesn't make a hill of beans of difference. There are people who live and die by the mask, and then there's people in between. I don't know. Cloth masks. I feel like, and this is just my personal thought. I've worn them both. I feel like the disposable masks, the ones that are blue and white, that are more paper, like what Charles is holding up right now.
Well, the surgical masks.
Yeah, I feel when I have that on, for some reason, I feel like it's a better barrier than when I put on a cloth mask.
Well,
I don't know.
The cloth masks don't work. That's why they got rid of them in 1918 when the Spanish flu was going around. They're not as effective.
Didn't they have those the plague doctor?
What is
the
that?
doctor. Oh, I'll get an image of it up.
Okay.
I'll get an image of it up.
That sounds
y'all
good.
know.
But no,
some people may know what I'm talking
The
about.
cloth masks are not effective. The CDC says they're not effective. My doctor called me and he said, "Hey, get surgical masks, John. Stop wearing the cloth masks. They don't work." The one with the valve in it, where, first of all, the air is not all going to suck in through your valve, number one. But again, remember, we're not protecting you. You're protecting everybody else. When you breathe out, it's not going just out through the valve either, and it's not effective at all.
Well, they're saying the ones that breathe out through the valve, it doesn't even stop anything. If they have it,
Right.
then they're expelling their breath through the valve, and it.
Well, and like the one I've got with the valve has filters, and I received 100 filters to change out my filter, and it's a charcoal type filter. I know those work because we use them for water to filter stuff out. But to what extent? And I'm being told there's just not much. And so the surgical masks are the best masks. You see people walking in with those doodaddy McJaggers that you can put over your entire head.
What Fred North put.
What do you put? Here's the thing, though.
And
your
can I
urine
do
is sterile
switch
and
on
not
this
dirty.
to show
Also
you an
think about it.
image?
Turn it on.
Okay.
If your junk is covered all day and not exposed to the air,
We have really gone off the rails
so
this
you wipe
morning.
yourself probably getting something on your hand, then go touch the faucet. Yeah, Fred, but if whatever, Fred.
I'm cracking up.
Fred's hilarious. You're killing me, Fred.
Oh,
So evidently, Fred does not wash his hands. He says, "Oh, I do wash my hands," but he makes an argument for not. You're gross, Fred. Fred, you get the "I'm gross" award from
no,
JP.
he's not. That's
Wait,
funny
don't do
though.
Wait, don't do it. Don't do it.
I was gonna do the.
Oh no.
So my point is, though, is you yourself be responsible for you. I will say this. I've had a lot of friends and people that I know that have gotten COVID-19. They've gotten real sick, and they start doing this vitamin regimen, and they seem to get better.
Yeah.
And they don't seem to have the after effects.
I don't think, JP, and if Dr. Good's listening, I know, I'm sure she'll chime in. I don't think there's anything wrong with supplements, vitamins. As a matter of fact, I'm a big advocate of those kinds of things. It can't hurt, and if it builds your immune system up such that you don't get the flu or you don't get bronchitis or strep throat or something like that, and maybe you don't get COVID because your immune system is beefed up. I don't think there's anything wrong with taking multivitamin, vitamin C, vitamin D, some elderberry. There's other things. Dr. Good, I know, takes oregano oil. That's supposed to be kind of like a natural antibiotic.
Actually, I think elderberry, you're not supposed to.
Well, now
At first they said no, but then they came back and said
Then they
yes.
came back and said yes. Because
Zinc, though, is very good.
Zinc's a really good one. Magnesium.
Cold-Ease has those zinc
Yes.
lozenges.
Which are, they taste awful, but they work. But the elderberry, and somebody correct me, but I remember at first, because I was pushing elderberry to my kids and my husband and any of my friends who would listen, I was taking lots of elderberry, and then somebody said, no, it it hurts you towards COVID, but then they came back and said, no, that's,
Right.
you know, I think that's because they were selling out of it or something, you know.
Distinctively possible. My point is, though, is that during this holiday season, act responsibly, be responsible, right? Don't infect those that are, ill or have issues with their health. Drop food off at the door. Let them come to the door, pick up their food. There's so many ways to video conference in now,
Right.
To a holiday meal, where you can, again, drop the food off ahead of time, start the meal at a certain time. Grandma, grandpa, uncle, aunt, they can be sitting at the computer and everybody's eating together still and talking still together. Again, just be careful.
What does your family do? Are y'all going to be in Arizona
No,
or
we're not
California?
going to California. No, we were going to go to California, but not anymore. California it's lost its mind.
Oh yeah, you can't go to California. Y'all wouldn't be able to do your normal family meal.
No,
You would have more than 3 households of families to get together, and so you can't do
gracious,
it.
Yes.
And I'm sending you. For some reason, my switcher won't pull up, so I just emailed you the image that I was referring to. Yeah. So are y'all going to be in Arizona or Texas?
No,
or?
we'll be in Texas.
Okay.
We're going to be here, and I think
Is it going to be a big celebration or just kind of a smaller?
Okay, there's like
small
50.
celebration.
Well, just pull up the one that says Plague Doctor.
Oh, gotcha.
That's the full body. It says like white
Chuck's
hat, scalpel.
Kathy,
all
there's
that.
50. There's 50 of them right there, Kathy. Help me out here, Kathy. So,
This is
anyways,
what I'm looking for.
and if you're
know, I
as
see.
part of the crew, share with us what
Yeah,
your
are you
plans
gonna
are
do?
for Thanksgiving.
Oh, and another one, Gail said, and this is a great one because it helps with your pH balance, and that's apple cider vinegar. And I finally found
well, yeah, that's what
gummies.
I was thinking you were talking
Yeah,
about.
that's what I was talking about. So back in the day, the Plague Doctor, it was like almost like a bird's beak. That was, very interesting. They had a cane for examining patients without touching them, a cloak. Again, they had lots of layers. They had fisherman's clothes on underneath. They had garlic, leather gloves, a scalpel for opening up. Pus things. A wide hat. So. They were identified as a doctor. So very interesting back in the day that this is where we were back then.
medieval.
So I guess it could be worse. I don't know.
So that's the plague doctor. So he's the PD.
Yes.
And then we would have the virus doctor. So he would be the VD.
Yeah, there you go. Good job, Charles.
I met someone who was actually their artist was actually making an entire Plague Doctor from scratch, a Plague Doctor costume with the beak and everything. So
Sounds like a new show or something on Netflix.
And there is one.
Plague Doctor.
The Order. Oh, sorry. So, anyways, point being is that over the holiday season, if you're traveling, it does seem like vitamin C is a good friend and a good helper. Load up on it.
Oh, yeah.
Will it protect you? It may to some extent. If you take a bunch of big old COVID in, then it may not. But again, just be smart about what you're doing and how you're going about your holiday
and
times.
I know we're we've got a big group getting together, and most likely my family, the majority of us will not be wearing masks. Now we're over at my stepbrother's home. He's got a really big home, really big backyard, so we'll be spread out to a certain extent. My thing is, and this is I need to talk to my parents or my dad ahead of time on this one. We're a big hug and kiss family, so it'll be interesting to see if anybody is not hugging and kissing.
Well, and again, it's just a matter of
So-
what are you able to do,
And what are you comfortable with?
right? What have you been around? Identify and pay attention to where you've been, who you've been in contact with. The other night we were in a restaurant, and there was no limit. It was packed, and I took my mask off at the table, and I looked at Courtney and I said, "If we get COVID-19 anywhere, it'll be right here."
Because there were just so many people in there.
I mean, there was no every other table.
I'm not
gonna
Tell me
say.
off air, because I have not been to a like when we took my son out for his birthday and then my daughter out for hers. There were tables around us that were empty.
Oh man,
We
Like
were
they
at
were
an
marked off.
entertainment venue for my son's birthday
Right.
last month. And we went on a Wednesday, and it was like, there weren't any people. Well, they were closing it down because they were having an event later on that evening. So we had to come back on Saturday.
Okay.
It was a madhouse.
Packed.
Yeah.
Wow.
So
Yeah, it's and again, then you make the decision. Do you go?
Right.
Do you go there? Do you eat? Do you eat there? Do you hang out? What? And again, I think it's up to the individual and the individual's family, and you decide and make your decisions accordingly.
Well, but again, it was interesting. I felt uncomfortable in this restaurant with all of these people.
So you didn't enjoy yourself like you normally would.
Not like I normally
Okay.
would.
Yeah, same with that
Interesting.
entertainment venue, too. It was just
Interesting.
I was just like, oh, my gosh, I can't believe there's this many people.
Yeah. And again, I think that we can continue to leave things open. I think we can continue to go and do things.
absolutely.
But it really, truly can't be one of those scenarios where you allow 100% capacity. And just, again, be careful. It's real. The cases that are out there have spiked tremendously. I think the other day we hit over 1 million cases again. And so this thing is running rampant through the country. Europe is shutting everything back down.
Well, Fred
again.
said in New York it's worse than California. He said no more than 10 people in a house. We couldn't do it. My family couldn't do it.
Well, and we say that, but in California, if you only have one bowl of mashed potatoes or one bowl of sweet potatoes, you have to hire somebody to come in, and they have to wear a mask, gloves, and it's one person serving. And you can't go back for seconds with the same plates or utensils.
Right.
I mean, it's and if you have more than, and it may be 10 in California now, more than 10 people, you have to go outside. and hold
Invest
your-
in paper plates.
Right.
I mean, like, invest in those companies that make paper plates.
Boy, no kidding, right? So anyways,
Well,
it's
the
just-
birth rate, is coming up. December is the month.
right.
And I was listening. Someone was saying, "Well, but we haven't really seen a lot of bookings for births for hospitals and things like that." Well, my daughter, who was telling me that, because they're going to midwives and things like that because of the restrictions they have at hospitals.
For a
and they're
while, yeah.
opting for home births.
Absolutely.
And things like that.
For a while, husbands, the father of the baby couldn't even be in the delivery room.
Right.
And that I was like, that's horrible. I was very fortunate. I even had when I had when I had CJ, I was able to bring my best friend and my mom in. So I had like 3 people in the delivery room with me, and it was awesome. I just I can't even imagine not having your loved one there for the birth of your child. So yeah, I would have, if that would have been the case, I would have looked at home birth or something in between. Luckily, they lifted that restriction fairly quickly. So.
Well, and it may go back in place depending on what's going on.
Well, and then Fred said that he was at Maggiano's in Plano on Saturday night, and the area he was in had glass between the booths. That's interesting.
Well,
I haven't been to a restaurant where they have that yet.
Oh yeah, I've been to several that have the plexiglass between
in between
the
the
booths.
booths. Okay.
Which again is interesting.
Have you seen that, Chambrielle? What now? Oh, Texas Roadhouse. Okay, interesting. Oh, and I've got a gift card there, so that's good to know that we'll be walking into that.
But again, it's interesting though because you're not in a bubble, and so air is still circulating.
Can you still do the peanuts on the floor at Texas Roadhouse? Oh,
Yeah, they don't have much people sticking their
darn.
hands in there.
Oh, they give you a bag of it. Okay, interesting.
Oh, they give you a bag.
Interesting.
There you go.
Okay. Huh.
So, but again, though, it's just a matter of being smart, right?
Yeah.
Black Friday this year may be an online thing. I know that.
Oh, it's ginormous and it's already started.
Yeah, my friend Laura, she does almost all of her Black Friday shopping almost exclusively
Right.
now, and has for years online.
Right.
And has had everything delivered to her. So, and I'm a big guy that I like going to the store. I mean,
Yeah.
part of it was meeting up with old friends that we hadn't seen all year.
Yeah.
And that was our gig. After Thanksgiving, we would meet up at 3 a.m. to stand in line at Best Buy
Not
and
this
carry
year.
our blankets and freeze our butts off, And so, yeah, it's just, I guess it's just a little bit different this year.
Yeah.
And, as I have said many, many a
Speaking
times.
of the plague doctor with those sunglasses and that mask,
He kind of looks like the plague doctor.
our
But
mental health moment.
yeah, getting ready to kick that off, actually.
Oh.
So, yeah, because it's 8:24. And we've got a great topic going to hit the mental health moment today, and
It's-
especially during the holiday season. I think it's very,
yes,
very
yes.
interesting.
Mental health. Take care of your mental health. Period. End of sentence. Please, please, please. If you feel you are suffering, if you feel you are in need, and we'll be giving out Chris with Acadia. We'll be giving out Chris gets her phone number. Please get help. Please ask your family members. Ask your family members. I have someone close to me who I felt was struggling recently, and when I asked them, they said, I need help. And it's one of those things. If your gut tells you that you have a friend or a family member that is having a hard time, just ask. I would rather somebody risk offending me by saying, "Hey, Kathy, I've noticed you've been off lately. Are you okay?" I'd rather know that somebody cares about me that much.
Right.
So,
So a lot going on, in discussing schools. We talked about that today as well. And it's one of these things that's being highlighted right now. The question is, why are we shutting schools down? Why are we threatening to shut schools down? Cuomo is saying, and I don't even call him Governor Cuomo because I've got no respect for that too.
he's on my last nerve.
Yeah, he's a tool. They're saying that if we hit 3%, then we're shutting schools down, and then we're going to look at it individually, school by school. And again, schools is not where the spread is coming from. It's these events that are going on at your homes. It's these events that are going on at bars. It's the after hours getting together kind of thing that is creating. And it's not at the workplace. It's not at schools because they're properly socially distancing. They're taking taking precautions to make sure that it's a clean, safe environment.
Right.
And so why are we shutting schools down? The mental health of our children is suffering dramatically. And I'm seeing that.
Oh, it's.
I mean,
And even with the social distancing, I've asked my son. So he's at a school that is a project-based learning school, PBL. They're used to being up and around and working with their groups and moving all over the building. Now they are sitting in the same spot all day long, masks on, socially distanced. The teachers come to them, and he's kind of like, his comment to me all the time is, "Mom, what's the point?"
right.
And and a lot of his friends are doing online. One of his buddies whose dad's a doctor, he's remote. And my son was like, he goes, at some point he goes, it's almost like I might as well just stay at home. And I said, no, but physically getting out of the house, driving to school, at least that's something. Plus he's able to go out with a buddy to lunch. I think even just scraps at this point. Take what you can get. I
agree. I mean, what's interesting is I would think that outdoor play would be a much bigger phase of schools right now.
Yeah, like I would. Yeah, especially while the weather's nice. Go outside. Sit on the concrete, sit in the grass, and have a class outside at least for 30 minutes during the day. And then I wonder, do they still, like, since I don't have elementary school age kids, this is my question to those of you who do they, at recess, are the kids limited? Can they play on the swings and the slides and stuff like that?
I would
or
think
is that
they'd be able to?
Or is that all off limits? And can you not, do you have to stay 6 feet away? And how do you tell a first grader to stay 6 feet away from their best friend?
Well, and again, I think
I'd like to know that from members of the crew who have elementary school age kids.
And I think that outside I don't think it's a bad thing. It's a whole different approach and whole different thing than being inside with recirculated air and all of that.
Right.
And so, Tommy Lasorda, Coach Quigley, shared that Tommy Lasorda was taken to the hospital.
Oh.
He has been upgraded now. He is in ICU.
Okay.
Don't know what it is.
Is it
have not heard
COVID
yet from.
or?
Well, don't know
Okay.
yet. Have not heard that from Coach. Of course, Tommy Lasorda, longtime manager for the Los Angeles Dodgers. Especially, I call them my Dodgers during the time
You do.
because that's when I became a fan. That's when I was a small child when
you were a
Lasorda had taken over the Dodgers.
Yeah.
And so a lot of those guys were my baseball heroes.
Yeah.
When I went to the Sandlot, I was always either, Ron Say or Steve Garvey or Mike Sosa, or I was Ken Landreau, or I was, Don Baylor, or I was, Dusty Baker, or, so always Fernando Valenzuela if I was pitching, because who didn't want to be Fernando Valenzuela, right? Or Jerry Royce, or Bob Welch, So again, big Dodgers fan. So prayers out to Tommy Lasorda and his family, and hope everything is going well
Yes,
there.
absolutely.
And so we have got in studio and seated, might I say, the mental health moment. We've got Steve Dunn and we've got Patty Giolet. I love that, by the way. I love that. So both in studio, Morgan Foundation, Something for Kelly Foundation. They both, I tell you, doing yeoman's work. Had a great event the other night I missed, and I apologize. Became so hyper-focused. Ended up out of town till 9:45. But just real quick, how did everything, give us a summary of how the event went and who your star was that night.
Much. We had an amazing night, Thursday night. We had Dr. Cynthia Bulick return via Zoom. She started out with a pre-recorded message for us because we didn't know whether or not she was going to.
Hold on one second. We want to have the audio on you. Oh,
Plug it in.
yep. So yes, high tech.
And good morning, Kathy and JP.
Yes, come on in there,
Love
Steve.
your bow tie.
How
Hello.
it went.
Yeah, Steve, tell us how it went.
It went marvelous. Absolutely marvelous.
Marvelous.
Okay, good. Still nothing. So
Well, he's plugging. He's trying to plug you
I
in.
know. I can see that. I can see that.
It was a great event because for the first time, thanks to Patty and SFK, there is now collaboration between the treatment centers and this incredible research doctor studying the
so
genetic
awesome.
aspects of this disease.
Good morning. Hey, there it goes.
Hey, there she is.
Good morning, everybody.
Hello.
Thank you, JP.
You're
yes.
welcome. So Dr. Bulick had a pre-recorded message.
Dr. Bulick had a pre-recorded message because, of course, in the era of COVID, we didn't know what we were going to have or experience. So she gave this amazing pre-recorded message talking about the work that they're doing. But what was most exciting and the biggest event of the evening was that the Something for Kelly Foundation, in collaboration with the Morgan Foundation, reached out to treatment centers all across the country.
Oh, great.
Specifically, we had Dr. Stephanie Setliff from the Eating Recovery Center of Texas. She's the medical director of several of their locations. Stand up, and we asked Dr. Bulick if she could come back on via Zoom live, which
Yep.
she did, so that we could then introduce Stephen Dunn, who then spoke with Dr. Setliff, who committed their resources in Texas to getting their inpatients involved in this study. It was the biggest success of the evening.
This is huge. This is huge in the field of eating disorders.
It really is, Kathy.
I just think about, having the conversations with y'all about this when you first started talking about this research, and for it to come to fruition like this so quickly, this is a God thing.
It really is.
All right, we want to go ahead and thank Acadia Healthcare for sponsoring the Mental Health Moment. For all of your mental health needs, if you are feeling grief this holiday
Yes.
season, if you're feeling anxiety, if you are feeling
Depression,
depression,
yeah.
if you're feeling suicidal, help me out here.
Ideations.
Thank you, ideation. Yeah, I
Yeah,
couldn't
if you
think.
just
I
don't
had
feel-
idiosyncrasies
if you
in my
if you
head. I'm
just
like,
don't
no,
feel like
not
yourself.
that.
Even if you just feel off or just
Hey,
not
this
yourself.
is a commercial, not a conversation.
I know, but
You've
this
gotta
is
stop.
but
I know, but talk about
we
it in a
don't have
second.
we're not in
Contact
studio
Chris
next.
Getz.
We're not in
Contact Chris
studio
Getz.
next week.
469-400-7499. 469-400-7499.
Will you say that again? I'm going to put that on our feed.
469-400-7499. And it'll be on the screen as well.
7499. Excellent.
Contact Chris Getz with Acadia Healthcare. Whew. Okay. Now feel free to have a conversation.
Yeah, you're doing an actual commercial read. Okay.
Right, and you're
for a sponsor,
and
which
Steve,
we appreciate them
Steve
so
and
much.
Patty, that's what you guys have brought to us today.
Today we're bringing to you the roller coaster of life and death and grief and joy. And I made some notes from the past 6 weeks because there's just been, you can't make up what I'm about to say here. So I'm just going to really hit the high and the low points, and let's jump right into things. On September 18th, my mom died in a rehab place here in town. Because of COVID, we didn't get to see her since February. And she passed on that day alone. Then we jump forward in time to October 24th, which was the 1-year commemoration date of my dad passing away last year. And then we jump forth in time to October 30th, which is the 4-year commemoration date, Morgan being taken. Well, then we start to get some good things going on in the November 5th SFK event, and I get a call that day from my son's wife saying, I think today's a day I'm going into labor. Great news there. So the event was a great success. And the next day at 7:42 a.m., I get the call, and my beautiful granddaughter has arrived.
Yay.
And she's healthy. Her name is Riley Amelia Dunn, R.E.D.
She's beautiful.
Which those are the initials of my dad's name, of course. And so everything is going just right with the world. And then on Sunday, November the 8th, ERC invited me to talk to a dad's group, and there were 39 dads in this group, and it was such a great experience. But things seem to happen when you least expected. Early that evening, I got a call from Gail, the wife of my older brother Chuck, and she is hysterical because the paramedics have just left with my brother Chuck. Apparently, he had a massive heart attack at home. Granted, this is guy 64, and he's a warrior. He runs marathons and buys and sails his own boats and works out all the time and eats well. So we have that going on. The very next day, we're here with you in studio with Brian Hufford. And he throws a great show on. We talk about the case. That's going to help so many. And not much else because we don't get much information from Tampa on my brother, of course. And then there's the next day. On Tuesday, November 10th, my son calls and says his wife is having some issues. Her speech is a little bit slurred. There's tightness in her arms. There's swelling in her legs. So he rushes her to the emergency room. Well, that afternoon, about 2:00, we finally get a call from Florida saying my brother had a massive heart attack. His brain is not responding. He's in ICU. And I am told that I'm not only the executor of his will, but the surrogate on his living will.
So you're making you're the one to make the medical decisions.
Yes. So perhaps for the second time in 4 years, I'm going to have to tell the medical providers to stop the life-saving treatment. How much fun is that going to be? It goes on. At 3:00 on November the 10th, I get a call from my younger brother who lives in California, who says, I'm in the emergency room right now. I just fell down some stairs. I might have a broken shoulder and back that's messed up. I mean,
oh my goodness.
Really, you can't make this stuff up. About an hour after that, after I talked to him, I'm holding my granddaughter for the first time. And, of course, the weight of everything and the tears are just flowing. And my son is looking at me because I haven't told him about his Uncle Chuck because I want him to focus on
the baby.
Baby, absolutely. So he's looking at me like I've got a second head growing out of my shoulders. And Patty's there, and she has to go to a different room because she doesn't want to tell him all of this. And so it's just the ups and downs, and I'm feeling both, of course. But then that night, I get an email from one of the dads in the group that I talked to on Sunday, and he said what an enriching life experience it was for him, that Morgan is doing great work through me, that he's been inspired to try that much more. And about 15 minutes after that, we get a call from basically the hospice people in Florida saying, get here as soon as you can. So with the tickets are booked the next day. Nothing happens on November 11th, yay. But then on November 12th, Patty and I are in the Uber on the way to the airport when we get a call from Chuck's wife saying, turn around, go home, because the hurricane that everyone thought had died had picked up intensity, had taken a right turn, and it was hitting Tampa.
You can't make this up.
No, you can't. So we of course go home, and by this time the dark humor is just coming out, and I'm telling Patty, of course, this is, my daughter is showing my brother around in heaven, and she said, Chuck, we can do anything we want up here. So Chuck says, well, let's see, and he gives my little brother a push down the stairs just to see. Morgan says, that's all you've got. Hold my beer. Watch this. And she makes the hurricane go off. So on Friday the 13th, we make it to Tampa and talking with the siblings and his wife and all that. The next day, we're at the hospital, November the 14th. And the decision is made. Of course, his brain is dead, but he wanted to be a donor, though.
Oh, okay. Organ donor?
Yeah.
Okay.
So now they're scrambling around trying to find a surgeon to be able to remove the organs, of course.
Right.
And I have to go in, and they have 1,000,001 questions, things like, has he been out of the country? Has he had sex with a person who's been in prison in the last year? I'm shaking my head going, well, I certainly hope not.
I don't think so.
But they have to
That's a
ask
question?
all of those. Yeah, because of the diseases and viruses and that sort of thing. So at 11 p.m. on Saturday night, the surgeon finally arrives, and they remove the tubes, and he breathes his last. But apparently, when the life treating medical devices are removed, you only have 60 minutes for the breathing to stop.
Okay.
If it goes more than that, they won't take the organs then.
Well, because they'd be damaged with the lack of oxygen.
Yeah.
Okay, that makes sense.
So, of course, he's not going to go out easily. In about 65 to 70 minutes pass, and from what I understand, they say that they can't now. So, yesterday, I guess it was, spent the day looking at the will and the living will and talking to his boys and his wife and all that, and we're back in town, and the fun has just begun. And it from an emotional point of view, I can't think of any other more extreme measures you can go through. I can tell you, the night before we left, we went out and had drinks with Stephanie Satliff. She's become a really good friend, and I didn't know till after the fact that she was performing her nefarious tasks on me and was shrinking my head and getting inside of me and getting me to try to get out of my own way, and gave me the name of a counselor to see. And I come in, okay, yeah, sure, absolutely. Especially because the counselor's name was Jerry Lewis.
But of course.
So we decided to go ahead and have a few drinks with her again last night, and I'll be darned if I didn't give Dr. Lewis a call. I've not heard back from him yet, but I'm sure I will.
Yeah.
And the process begins. And as you said, right before we came on, with the holiday season coming up and COVID coming up, and is your family going to come in or not, there's never been a more important time to get the help you need. You can't be shy. You cannot back away from that. And if a guy like me who believes that I can do anything and everything finally throws his hands up in the air and says, Okay, Lord,
yeah.
you made your point. It could have been done a little bit more delicately.
Had to drop a ton of bricks on your head.
And yes, and he did. But this isn't about me. It's not feeling sorry for me. It's simply about getting a story out about how grief in life impact your life and things you can do to get help you may not even know you need.
So true, so true, and and I'm so proud to be your friend, both of y'all. For you to come on, I mean, you're a sharp guy, extremely intelligent, successful attorney, but it's okay to ask for help. It's okay,
Absolutely,
and good for you for revealing that in a very public manner.
And I really didn't think about it this way until Miss Patty over here brought it up yesterday and said, "Yeah, Steve, you've had 3 significant deaths in 1 year," and I really didn't even think about that, Patty. Thanks a lot.
Yeah, but you did. Yeah, but you did.
And no matter if you think you're in the best shape of your life, because he was, and when we went to his house, we saw all of the marathon posters he's had, and he's run 13 of them and sale. He was a larger than life guy. And JP, if he was standing next to you, let's say, and you asked 100 folks, okay, between JP and Chuck Dunn, which of the two is likely to have a heart attack before age 65? Probably 99 of them would say you, of course. But it's not like that.
When it's your time,
and the
it's your
likelihood
time.
of that for me is very low because my genetics don't say that. My genetics are all this size, and we live in our 80s. And I've told Kathy, and Kathy's like, "Don't say that." And I'm like, "Well, but it's true.
It's cancer.
It's cancer. My family
Later
is
in life.
cancer, and it's late 70s, early 80s."
See, now, do y'all have? Is there any heart disease in your family? And does this make you worry?
Yes and yes. I've got.
Okay. No, I mean, not to be Captain Obvious, but I'd be like, okay, should you get a yeah, exactly. I'm like, okay, I do know CPR.
I'll jump on your chest, Steve. I'll get that heart restarted.
Well, in fact, on my mom's side, there have been some heart issues. Both of my uncles on her side passed away before age 65. I think even before age 60 from heart condition. So there is that, and of course with Chuck now. So Patty last night was asking me things like, okay, Steve, is your will up to date, and am I included in it, and what are all the passwords? That is something else. People, estate plan. Fill out your directives to physicians, your living wills, and
let somebody know what your what type of service you want. Do you want to be cremated? I mean, all of these things.
Absolutely,
So
yeah.
that way, it takes away an argument. Because I've often thought my mom would probably want, if I were to pass before her or my husband, she would want things a certain way. My husband would want things a certain way. I don't want them fighting at the end of the day. So I've right there at the dinner table had the conversation of, hey, this is what I want just in case.
Well, that's a very good point because Chuck has 2 children from a prior marriage, and the fact that he had already created this living will helped tremendously during the conversation about palliative care versus ongoing treatment and what would he want, and that's very important that was already in place so that Steve's job as the executor or the surrogate of the living will was made very clear. He just needed to facilitate the choice. And the choice was very obvious. You follow what the person's wishes were. So
It's a member of the crew said they're very sorry for your losses. So
Thank you. Also, one thing, and this is incredibly important as well. I'm going to be facing this afternoon. If you're in a marriage relationship, make sure your spouse knows the passwords to your computer,
Right.
your
Problem
laptop.
is I don't know them.
Make sure that on
Yeah,
your
that's
bank
true.
accounts that you have someone listed as a joint tenant with the right of survivorship, so the bank will just pass the funds on to them. There's got to be someone you trust that you can pass that information on to, because we're looking at a situation where Chuck paid all the bills online.
Yeah.
Gail doesn't know how to get into his computer or bank account or pay bills, or she's asking me all these questions, and we're going to work things out. But people, make it easy on yourself. talk to your spouse. Make sure the passwords are written down. Maybe not those dodgy passwords to those websites that you don't want them to know about, of course. But
clear out your search history. Well, JP said just literally, we were up here on Saturday. We were producing Kilroy's Conversation. Oh, and by the way, Gail Meeks of Gail and Steve's show Money Links, she said watch our show on estate planning. Extremely important.
This Sunday at 3 o'clock, and
so
then
that's
again at Thursday.
Yeah, so definitely get that out there.
Thanksgiving 7:30.
But when JP and I were up here with Kilroy's Conversation after the show, and I was like, don't say that, but you know what? It's good to know because he's got all of the information for our network on his laptop. So he said, hey, God forbid something happens to me. He said I could walk out of here and get hit by a bus. You never know. And he said, this is where you go on my computer to find all the business information because he's the one who keeps all of that. So it's just simple things like that. You can avoid those conversations down the road. I've got a dear friend of mine. I'm the executor to her will and or will be when hopefully a long time from now. But she told me that, and she's let other family members know that, so they're not shocked that hey, if I pass, you know what? It's not a family member. It's a dear friend.
Yes.
So I think that's important.
Again, we want to thank Acadia Healthcare for sponsoring the Mental Health Moment here on JP, Kathy, and the crew. Again, if you find yourself experiencing grief, if you find yourself experiencing suicidal ideations, if you find yourself with anxiety that's overwhelming you or just need someone to talk to, Chris Getz is your personal concierge at Acadia Healthcare. Look her up, give her a call, or you can go to their website. You can call Chris Getz anytime, 24 hours a day. She is available to you and will answer the phone. Her number again is 469-400-7499, 469-400-7499.
Steve, I want to turn the conversation just ever so slightly for the listeners to understand. What you're doing today is really quite brave and raw and authentic, but not everybody can do this immediately afterwards. And in fact, you were not able to do it immediately afterwards when Morgan died. So I do want to put a little bit of perspective around this because even our dear friend, Dr. Setliff, and I were having this conversation about, is this too soon? Is Steve really ready the next day to come in and be this raw? We had an experience last year at a filming of grief, at a filming of people dealing with grief. And we have come to refer to that day as Tragic Sunday because it happened on a Sunday. And I would like to invite you to share that story because it's not everybody right away. And let's put some perspective around whether or not you should be talking so publicly in the immediate aftermath.
Absolutely, and for me, it was about 3.5 years after Morgan was gone. But there were two other dads there. No, I'm sorry. There's one dad. I'm going to just focus on him. His daughter had been killed in a car accident 3 months before, and this dad gets up there and he said, well, I've had friends come to me and say, it's time to get past your grief and you can do this. And so he's standing there and you just look at him. You can just smell the grief and the pain within him, but he's talking like he's okay and he should be able to give advice. It doesn't work that way. I know that I am just, a hot mess right now. So, but also I believe that grief is not a linear thing. It's not where it's agonizing here and then straight down the line there, it improves. Yes, we get to go on our lives with a more productive way, but it's always with you. And it might be the scent of a flower or a song that just brings it back. But talk about it, though, and acknowledge that it's okay to hurt. Well, I'm in a lot of pain right now. And the difference between, I think, me and this poor dad was he didn't have the support staff around him that I'm lucky to have. Everyone in this room are tremendous support staff. I think it's important as well, when you see a counselor, ask them questions about their background, what evidence-based treatment they provide. If they have been in counseling themselves, you're trusting your heart to these folks, and they had better answer every question to your satisfaction. And if they don't, look somewhere else. It's incredibly.
That's a good point.
This is basically a job interview
Yes,
that
yes.
you're conducting for them on something incredibly important. People ask questions. Do your homework beforehand. Research them so you find out a little bit about them. And if they back away and don't want to respond to that, then they're not the right ones for you.
Yeah.
Well, and for years I have
That's a good
said to
point.
families, not every counselor fits every family.
No.
And you really do go in and need to interview them to make sure they're a good fit.
Yeah, if you don't get a good vibe or a good feeling, you know what? You're not hurting anybody's feelings. Just say, when they say, do you want to make a follow-up appointment? Say, I don't. I'd like to know what other therapists are available.
Well, and there's an assumption I think we make as well that if you've got letters behind your name or if you're a professional, then everybody has graduated from the top schools in the country with straight A's. And it's funny, I've always made the comment when I go in and look at a medical doctor, I ask them, what was your GPA in medical school?
Yeah.
And they'll either tell me or they'll ask me to leave. And they're like, well, why does that matter? I said, well, because to be honest with you,
I need the
I
top
don't
of
want
the
to get
class.
advice from the guy that got 67% all through medical
Yeah.
school. I want the guy that got a 98%
Yeah,
all the
that's
way
a good
through
point.
medical
You don't
school.
want, the guy who, I passed. Oh, what?
Right. And so so it is important to make
Yeah.
sure it's a good fit as well. It may not be that they're medically incompetent or they're counseling incompetent. It may just not be a good personality
Right.
fit for the two people as well. So
That's a really good point to make because it's to your credit. The person could be very professional and have all of the credentials, but Steve, your personality is not going to fit with a lot of folks in the treatment.
What?
but Jerry Lewis it will though.
This is breaking
Jerry Lewis
news.
No,
got
seriously.
a great start.
But Chris is, Chris Gatz, I've got her on the mind.
Patty.
'Cause I just saw, no, Chris, because I just saw Katie.
Patty.
No, but Steve,
Hi,
because Steve's a
I'm
very,
Patty.
he's got a very dark, hilarious, but jacked up sense of humor. You do.
Now it's time to go to commercial
Yeah,
break.
he's a mess.
No, I
Yeah.
don't mean that.
Sponsored by the darkness.
I do not mean that in any disrespectful way.
No.
But Steve, yourself, you have said for the last few years you would not go to see a provider because you could beat them up emotionally and fight back, and they would not be up to par. And it was really, this is important stuff. For the last several years, people have advised you to seek counseling, and you demurred. You're like, no, I'm not going to do it. I could walk circles around them. Morgan was the same way, you said. And so I'm just, to John's point, not everybody's going to be a good fit, and you're willing and you're authentic to
John's
be
like,
out
"Get me
there.
of this."
Yeah, and a lot of that came about. We found that a number of counselors in the eating disorder community are still in active recovery themselves, and they're getting as much out of the session as the people that they are
interesting.
trying
Okay.
to counsel. That is a huge issue in the community right now, that we get these counselors out there who aren't all the way recovered, and as a result, the advice they're giving might not be, and probably is not, the best advice, because they're in some ways treating themselves at the same time.
Well, and I could see Steve with as intelligent as you are, and as much as you like to banter, and I could see you end up counseling the counselor.
Oh, interesting.
In all truthfulness,
Yes.
because you will see it and not take
that's very
advantage
good.
in a
That's a good
bad way,
point,
but take
yeah.
advantage in a good way to try to help them, because that's what your heart is.
Oh, yeah.
And yeah,
and you're super smart. That's a problem.
It can be, yeah.
Well, and again, and he's got a very ironic sense of humor, a jacked up,
Iconic?
hilarious, dark sense of humor, and so not every he is iconic. So not every therapist is going to be able to hang with that. They're going to be like, wait, I need to analyze that. No, that's just part of who Steve is. You need to let that part go. Let's work on,
And I've thought about that. I've thought of being and talking to a counselor, and I did for a while, but I imagine going into one now and saying, okay, my daughter died 4 years ago. One of the things she said was, I can seem to help everyone else, I just can't save myself. I've given TEDx talks, I've done this and this and this. Let's see what the cards you have are. Put them out on the table now.
Yeah.
And I don't want to hear how you've counseled others. I want to hear how you've counseled yourself.
That's a good point.
Some of the things
I
that
never
you
thought
have
about that
been
with the therapist.
through.
That's
Yeah.
interesting.
So, and it's not a zero-sum game type thing, but it lets them know that you expect them to have a heck of a lot of credibility and experience. And if they don't, you're going to dump truck them. And there was a counselor here in town that Morgan said, Daddy, I don't know if I should continue to go to her because I can talk about anything I want and I can just run over her.
Yeah.
So,
And a lot of teenagers do that when they go to therapists.
you know, at $200 an hour, I thought, Morgan, what a great idea. Let's not go back to her.
Let's find somebody else. So
Okay.
That's just what I'm saying. It sounds like this gentleman's going to be a really good fit for you, and compliments to you to what Kathy said, going public
Absolutely.
with the situation so early. So
Yeah. Yeah.
And people here in the North Texas community, we do have some fabulous counselors, therapists,
We do.
psychologists, psychiatrists, people like Vanita Halliburton has
Oh,
an
yes,
extensive
yes.
list, and Philip Van Gilder does as well. Friends
Oh,
at
great guy,
ERC and Chris Getz, make calls, reach out, get help, because the life you save really will be your own, as contrived and as that is to
True,
say.
though.
It's
Yeah.
true though.
So the best advice comes from those who have the wisdom and the knowledge from the experience that they had to go through and can now pass that on. We're entering the holiday season, Steve. We're at the end of time today. Let's leave everybody with your wisdom and your advice as they enter into the holiday season.
We're coming out of a time of isolation and fear, anxiety, depression. And it's perfectly okay to respect COVID, but you don't have to run in fear. Make smart plans with your family, with your siblings, with your kids, and embrace the incredible love that will be surrounding you. And just reach out, talk. At Thanksgiving, instead of running in to see the football game right after you eat, sit around the table and say, okay, we're living, this past year has been absolute heck, but say one thing that has given you hope or love or that you're thankful for, and go around and have everyone do that. And if you do, you're going to just put yourself in a better place, so when December comes along, you slide into the month with more a feeling of hope and renewed faith and love.
All right, with
love
that,
that,
let's get us out the door. Great advice.
Great,
Want to thank
yeah,
Steve
thank
Dunn
you.
and Patty Gillette
love
for
y'all. We're very
coming in with
thankful
the
for
mental health
y'all.
moment, first of all.
Yes.
And let's getting it back fired up again. I mean, what a time when we absolutely need it. And Steve, again, the more knowledge and experience you can pass on personally, the better people are off, because it's coming from somebody that's living it versus someone that may be just advising it who's never had to live it at all. And so I've only had a very small touch, thank God, with losing my mother, and still, I'm still spinning.
That's not a small touch at all.
Yeah, I'm still spinning. So my dad is still spinning. And so, but lots of respect and appreciate what you're doing and what both of you are doing to bring this to the forefront and to the top. And again, Acadia Healthcare as well for sponsoring the mental health moment. So with that being said, we will see you on Wednesday. That day is full of politics.
Oh,
so
my.
buckle up
Nothing to talk about.
and get ready to
Nothing
go.
to see here, folks.
Yeah, court
along.
cases and all kinds of fun stuff taking place. So Wednesday, gear up, get ready, because we're
Here we come.
loaded. We're loaded for bear
We are.
for sure. All right, we're JP Cathy and the crew on the JPK Broadcasting Network. You can find us at jpkcrew.com. That is jpkcrew.com.
Love y'all. Have a blessed day. Mwah.
And hook 'em horns. Yeah. You read my
I
mind.
knew y'all were going there. Thank y'all so